Thank you very much. Good morning, ladies and gentlemen of the press. This is a statement on the unfolding health crisis in St. Lucia. As we witness the continuing deterioration of our healthcare systems, especially at the Victoria Hospital and the George Odlum Stadium, we have little choice but to lament the collusion of ministers of government with Prime Minister Alan Chastanet, as demonstrated in the recent debate on the motion of no confidence in the Prime Minister. The ministers are supporting the lack of urgency which is being demonstrated by the Prime Minister, who is not taking actions which will bring relief to patients and staff who are forced to endure the most deplorable conditions at those hospitals. How can ministers look the nation in the eye and say that they support what the Prime Minister has allowed to take place in our health sector over the last 2.5 years? Do they really believe he deserves a pat on the back? Or are they engaging in the most despicable demonstration of self-preservation and self-interest over the national interest ever witnessed in our country? Since our last press conference on health matters, reliable reports indicate that the Victoria Hospital has had to accommodate patients for days in the casualty department. Inadequate X-ray services at the St. Jude Hospital has forced patients to seek services outside of the hospital, thus delaying critical diagnosis. There continues to be an acute shortage of important medicines for the treatment of St. Lucians and other people who access our health services, and more St. Lucians are faced with the reality, in some cases, and the possibility that a loved one will die because of the indecision of the government and the careless manner in which healthcare matters have been approached. Increasingly, reports of St. Lucians who are afraid to visit the St. Jude Hospital or Victoria Hospital as a result of the worsening conditions are growing. During his New Year's address to the nation, the Prime Minister indicated, and I quote, "I am pleased to announce that we have already commenced clearing works for the new hospital wing, and the Ministries of Health and Economic Development have finalized the designs." The questions remain. 1. Have the designs for the new wing at the St. Jude Hospital been discussed with the Medical and Dental Association? 2. What exactly will happen to the rest of the St. Jude Hospital buildings? 3. Will the east wing of the St. Jude Hospital be demolished to accommodate the so-called new wing? On the issue of the OKEU, the Prime Minister continues to mislead the public. He indicated in his speech that there was no plan for the OKEU. We remind the public once again that the government of the United Workers' Party found a commissioning team in place for the OKEU headed by Dr. Stephen King. There is still a report which is available called the Commissioning Status Report as of March 2016, revised. Even more disturbing was the minister's response to the media a few days ago. When asked about the healthcare crisis, Minister Mary Isaac responded in this way, and I quote, "In terms of the health status of the nation, I'm going to give you a briefing as soon as I'm able to do so. Relevant associations and of course the media is going to be at those briefings," unquote. It is clear that there is no urgency in her response. We are ending the first week of February 2019, and according to medical professionals, people are dying because of the worsening conditions at our hospitals. Yet the Minister for Health has not, by her own words, briefed her staff, and she has not briefed the relevant associations, by her own words. When questioned about the impending privatization of our hospitals, the minister responded in this way, and I quote, "I do not know what we have. I do not know that we have any deal with Health City Cayman to finalize. We have about 3 different consulting agencies on the table, and as soon as we hear from all 3, and we have all the information from all 3, the Ministry of Health is going to take a decision, and everybody else will know what that the other 2 players, one is PAHO. The consultants were here this week. The consultants here on Monday, and we also are expecting something from Colombia, unquote. But this is the same minister months ago who vehemently denied that there was any plan to privatize our hospitals. This is the same government that claims that the transition process to the OKEU is going smoothly. Yet today, we are hearing from the same minister that there are 3 possible operators, 3 possibilities of operators for our donated OKEU hospital. We continue to insist that our hospitals must not be privatized, and the St. Lucia Labour Party government will do all it can to undo any privatized arrangements at our hospitals. It is clear that the government has been taking the people of St. Lucia for a ride on the issue of the St. Jude Hospital and the OKEU Hospital. The people of St. Lucia and all people who visit our hospitals are suffering, some quietly, some indefinitely, as they see their children, spouses, and relatives die before their very eyes, in some cases because of worsening conditions. Some people have the means to access medical care overseas by emergency helicopter evacuation. However, all of us, even those who can afford to pay for the helicopter service, need the initial professional care of our emergency services right here in St. Lucia. The St. Lucia Labour Party therefore calls on the government to, 1, immediately provide St. Lucians with an update on the specific concerns relating to the impending privatization of the OKEU hospital. 2, recommence work on the incomplete St. Jude Hospital buildings instead of starting the construction of a new wing. 3, return to the table and hold discussions with the Medical and Dental Association. The St. Lucia Labour Party reiterates its positions on the government's callous actions. That 1, there must be no privatization of the operations of the OKEU and the St. Jude hospitals. That 2, the St. Jude Hospital project must recommence without demolition of the already built structures. That 3, the universal healthcare model, which was started under the previous St. Lucia Labour Party government, should be continued. And 4, the jobs of our nurses and medical staff must be secured. We are aware that the Prime Minister has told the whole world that he does not listen. We impress upon the government to take the life or death situations which happen every day at our health institutions seriously. We urge the government and the Prime Minister to take the life and death situations that are happening every single day, some as a result of the deteriorating conditions at our hospitals, to take them seriously. Thank you very much.